Going to wipe the skin. Hello everyone and welcome to Dermacure Clinic. It's Eleonora here and today I will show you how I perform plasma pen treatment on upper and lower eyelids. I will do slightly stronger treatment and I will actually extend around her eye area. So I will be using the Plasma Pen device, which is German made up from aluminium, and it's extremely light. It's very easy to use. It's a professional device that we are selling, and if you're interested in that device you can look at the website. I will leave link at the description. I love the device. I've seen great results with that device. It comes with disposable needles, so you can also purchase the needles through us after that. Very happy with the quality of the pen. I've been using it for a couple of years. It's my favorite one so far. I've used quite few brands in the past, and actually one of the top quality brands, and to be honest with you, this is my favorite. It's more affordable than the ones I've used before, so you can look at them. If you're interested in that device, please let me know. You can ask me any questions for the device as well, and I can give you some advice related to that treatment. For sure, I'm telling you that this is the same like laser in terms of cancer and so on. I just performed the treatment, so my customer almost didn't feel anything throughout the treatment, which is really good. No pain, or like from 1 to 10, what would you say did you feel from 1 to 10? 10 is the highest, 1 is the lowest.
Most of the time was 0, just in certain areas was more like a 5.
Okay.
And at the moment, I would say it's about 3, 4.
Okay, so it's like really mild. I'm
Really
going
mild,
to,
yes.
I wipe the area with Clinicept, so antiseptic, and I also will be applying Aqua 4 cream. It's kind of Vaseline based cream to be because that's going to help to take the heat away from the skin. That's all I'm going to apply, and I will leave it like this. So we can just keep your eyes closed. I'm just going to use cotton bud very quickly. The Aqua 4 cream also prevents transepidermal water loss. So otherwise the skin becomes very dry and it's kind of pulling. So it's, yeah, and of course this is better for the healing. I'm going to give her aftercare advice. So for the next 5 days, I would say, avoid hot showers, steam sauna, or any active exercises. So nothing that can stimulate more heat, because there's going to be a lot of heat accumulated into that area. So this is very important. Don't touch the area. Don't help those scabs to come off, because the skin will form scabs. Obviously, we can already see darkening. They will get darker within the next few days, and they will eventually scab off. They will start coming off. So try not to kind of speed up that process. So avoid touching the area, scratching the area. You might feel a little bit itchy after day 4, 5, but please don't touch the area. So this is really important, because if they come off before the skin underneath is ready, potentially can leave little scars, so we have to treat them later on. So that's why it's very important to follow strictly the aftercare advice. No sun exposure at all, no active sunlight on the skin for the next a month or 2. It's very, very important. So if you're going to go outside and it's really hot, please wear visor, like a hat with something that completely blocks the light. You can wear sunglasses, but please be aware that the actual light from the sunglasses can go through the sides if this area is open, because usually sunglasses will have that area open on the side. So it's really, really important to have everything blocked, like you should block the sun. The sun stimulates our cells that produce pigment, melanocytes, which is very important not to be stimulated during that time, because actually we're causing trauma, which is controlled, but we are causing that trauma, and that trauma will eventually lead to hypopigmentation if we are exposed to the sun. So it's very, very crucial at that moment not to expose to sun. Once the scabs come off, yeah, you can just continue with some kind of peptide serums. Is very good. Moisturize that area and always apply sunscreen anyway. So even, you're at home, it's fine because it protects you from any light. So we can see here the skin straight after the treatment. It's slightly swollen and hot. This is the next day. It's quite swollen, but this will go. This is 3 days after. You can see the scabbing has started to reduce. 7 days later, almost all scabs are off. And these are the results. Incredible results. You can see how much her eyes are open. And not only that the eyes are open, but also a lot of skin has shrinked after the procedure. This is 1 month later, and actually the skin will keep improving and keep shrinking in the next couple of months. So the results really will be best in couple of months later. You can see that most of the extra skin is gone. Of course, I do recommend another couple of sessions in another 3 months interval. So she needs to have 3 months between each session to allow the skin to fully recover and heal. This treatment greatly replaces blepharoplasty, which is an eyelid surgery. It's non-surgical eye lift and requires much less downtime, which is the most important thing. So thank you so much for watching. If you have any questions related to that treatment, you can put them on the section below. If you would like to see more videos like that, you can subscribe to my channel, and if you're interested in the device, I'll leave the links at the description below. So yeah, you can have a look at it, and if you have any questions, please ask me. Thank you so much, and I'll see you in my next video. Bye bye.